Mounjaro injections for weight loss, the ultimate deep dive introduction. In the evolving landscape of obesity treatment, the emergence of Mounjaro, tirzepatide, has generated immense excitement and significant scientific curiosity. Approved initially for type 2 diabetes management, Mounjaro has shown profound effects on weight loss, leading many to wonder, is this the next revolution in obesity treatment? This article provides a comprehensive and in-depth exploration of Mounjaro, its pharmacology, mechanism of action, real-world effectiveness, clinical trials, side effects, dosing regimens, and its impact on the future of weight management. What is Mounjaro? Mounjaro is the brand name for tirzepatide, a once-weekly injectable medication developed by Eli Lilly. It belongs to a new class of drugs known as dual GIP and GLP-1 receptor agonists. This means it mimics the action of two naturally occurring gut hormones, GLP-1, glucagon-like peptide 1, GIP, glucose-dependent insulinotropic polypeptide. These hormones regulate insulin secretion, glucose control, gastric emptying, and appetite. By activating both pathways, tirzepatide offers a unique dual action, leading to superior weight loss results compared to traditional GLP-1 agonists like semaglutide, Ozempic, Wegovy. Mechanism of action. Mounjaro, tirzepatide, operates through two primary hormonal pathways. 1. GLP-1 receptor activation stimulates insulin secretion in response to glucose, reduces glucagon release, which would otherwise increase blood sugar, slows gastric emptying, keeping you full longer, suppresses appetite centers in the brain, especially the hypothalamus. 2. GIP receptor activation enhances insulin sensitivity in adipose tissue and muscle, promotes a synergistic effect on appetite suppression and energy balance, may reduce inflammation and oxidative stress in metabolic tissues. Together, these pathways decrease caloric intake, improve insulin sensitivity, and encourage fat metabolism, especially visceral and subcutaneous fat. Mounjaro and weight loss, what the science says. Clinical trials have shown remarkable weight loss results with tirzepatide. SURMOUNT-1 trial, 2022, participants, non-diabetic adults with obesity. Duration, 72 weeks. Results, average weight loss, 15% of body weight on 5 mg, 19.5% on 10 mg, 22.5% on 15 mg. Tirzepatide, 1 in 3 participants lost 25% or more of their starting weight. In contrast, Wegovy, semaglutide, showed a maximum weight loss of about 15% in similar trials. This makes Mounjaro the most effective anti-obesity drug ever studied to date. Comparative effectiveness, Mounjaro versus Ozempic, Wegovy feature. Mounjaro, tirzepatide, semaglutide. Mechanism, dual GIP plus GLP-1, GLP-1 only. Max weight loss, up to 22.5%, up to 15%. Onset of action, faster, slower appetite suppression, stronger, moderate to strong side effects. Similar GI effects. FDA indication type 2 diabetes 222, obesity 2023. Diabetes, obesity. Dosage and administration. Starting dose, 2.5 mg subcutaneously once weekly. Titration. Increase by 2.5 mg every 4 weeks as tolerated. Target doses, 5 mg, 10 mg, and up to 15 mg per week. The gradual increase helps minimize gastrointestinal side effects. How does Mounjaro affect appetite and cravings? Many patients report significant appetite reduction, decreased food noise, mental obsession with food, improved portion control, reduced cravings for carbs and sweets. This is likely due to hypothalamic modulation of hunger hormones and slowed gastric motility. Who can use Mounjaro? Approved for adults with type 2 diabetes, adults with obesity, BMI 30, or overweight, BMI 27, with a comorbidity, hypertension, dyslipidemia, etc. Not approved for type 1 diabetes, pediatric use, pregnant or breastfeeding women. Side effects and risks. Most common side effects are gastrointestinal, nausea, vomiting, diarrhea or constipation, abdominal discomfort, indigestion. Less common but serious risks include pancreatitis, gallbladder disease, thyroid C-cell tumors, in animal studies only, hypoglycemia, when used with insulin. Patients with a history of medullary thyroid carcinoma or MEN2 syndrome should avoid Mounjaro. Cost and accessibility. Retail price, 1,000 plus per month without insurance. Insurance coverage, increasingly common, especially with diabetes diagnosis. Manufacturer coupons, often reduce costs significantly for new users. Real-world testimonials. Many real-life users report, "I've tried every diet for 20 years. Mounjaro is the only thing that worked for me. The cravings disappeared. It's like my brain finally shut off the constant urge to eat. I lost 50 pounds in 6 months. I feel like I have my life back." However, others struggle with side effects or weight regain if the medication is stopped. Long-term use and sustainability. Obesity is a chronic, relapsing disease, and most users need long-term treatment to maintain weight loss. Stopping Mounjaro often leads to weight regain, especially without lifestyle changes. Experts compare it to cholesterol or blood pressure medications, effective while you take them, with relapse risk upon discontinuation. The future of tirzepatide. Tirzepatide is being studied for non-alcoholic fatty liver disease, NAFLD, polycystic ovary syndrome, PCOS, cardiovascular protection, addiction behavior modulation. Its dual mechanism is opening new frontiers in metabolic disease treatment. Summary of key benefits. Massive weight loss, up to 22.5% in trials. Dual hormone action, GIP plus GLP-1 for superior effect. Appetite and craving control, brain signaling reduction in hunger. Blood sugar improvement, originally for type 2 diabetes. Cardiometabolic protection, reduces inflammation and insulin resistance. Final thoughts. Mounjaro represents a transformational leap in the medical management of obesity. While not a replacement for lifestyle changes, it offers real hope for millions who've struggled with weight loss for years. With proper supervision, dosing, and long-term planning, Mounjaro could be a life-changing tool in the fight against obesity. However, education is key. Patients must understand how it works, why it's effective, and how to use it responsibly.